Welcome back. Healthy adult volunteers have been inoculated with a weakened dengue virus as part of efforts to help researchers better understand the disease. The National Centre for Infectious Diseases' first-of-its-kind study is the first step towards the acceleration of vaccine development. The centre will analyse the data over the next few months and share results publicly next year. The 5 adults, 1 man and 4 women not present at the announcement, have since been discharged and are doing well. They underwent strict medical supervision and will go for regular checkups for the next 3 years. There are hopes that this approach will yield data that will shift treatment from managing the illness to preventing the disease altogether. There is no specific antiviral treatment that directly targets the virus, and the centre says the study positions Singapore as a key contributor to dengue research. Findings are expected to benefit places like Southeast Asia, Africa, and South America.
We noticed that this trial that the patients encounter is like mild symptoms. It's like such as it's like headache and rashes. That we did not encounter is like any patients like experience like serious symptoms such as it's like high fever, bleeding. Yeah, so those that the common symptom from the dengue lah, serious side effect from the dengue.
When one of our volunteers agrees for us to inoculate them with the dengue virus, we know exactly what we're giving them, how much and when as well, which means that we can very precisely track what's happening afterwards, both in terms of how the virus is reproducing, how the immune system is reacting, and also what symptoms somebody is experiencing.
And Associate Professor Barnaby Young is here in studio with us right now for more on the story. Welcome to the show, Professor.
Thank you. Thank you for having me.
First of all, can we talk a bit more about why dengue is so important when it comes to research at this point? We've heard earlier that it does affect the region, Southeast Asia, Africa, and even South America.
Yeah, that's right. So actually the numbers associated with dengue around the world are staggering, really. It's estimated that there are 400 million infections every year. Dengue has been reported in more than 100 countries around the world. I think one of the few places is Antarctica where there's no mosquitoes. And about 5 billion people are at risk for getting the infection every year. So we really need ways to prevent people from getting sick and prevent people from actually getting the infection as well.
Right. And this study is working its way towards looking at an antiviral treatment. At this point, if someone gets dengue and they're hospitalized for it, what are the options for them available?
So when someone is diagnosed with dengue and they're seen at the clinic down at NCID, the first thing that we'll do is assess, do they have warning signs which might suggest that they're at risk for developing a severe illness? And the typical warning signs that we're looking for are severe stomach pain, persistent vomiting, or bleeding. And if we do find someone who has those symptoms, we bring them into hospital so that we can closely monitor them and give them supportive treatment to try to help them to recover. And that means we're giving people paracetamol or intravenous fluids. So very, very basic treatment. And what we don't have is anything which can specifically treat the virus. So we don't actually have an antiviral treatment that we can give to people to help them to recover faster, to help their symptoms recover, and to prevent them actually progressing to a severe illness or even death.
Yeah, so we're treating the symptoms and we're not really targeting the source or the root of the issue.
Yeah,
but this study does give us a look into it, I suppose. So the 5 volunteers that were injected with that virus voluntarily.
Yes.
Tell us more about that. Why are we inoculating humans with the virus? What are you trying to find out here through this study?
So the way I like to think about this is that it is precision medicine, because with dengue, naturally, when somebody is infected, there's a lot that we don't know. So there's a long period sometimes between when somebody is bitten by a mosquito and gets the infection to when symptoms are going to develop. And what determines what's going to happen after any symptoms develop is really what happens in that first week when the virus is beginning to replicate. And the only way that we can really study this period in detail is with a controlled human infection. So a human challenge study where we are inoculating volunteers. And it's precise because we know exactly what we're giving them. We know when we're giving them it to them. We know how much of that virus they're receiving as well. And then each day we can track precisely what's happening to the virus and also what's happening to their immune system as well as their symptoms as well.
We know the study ended in May, but we can only expect the results to go public sometime next year. But do you have any initial findings that maybe you can share with us?
So yes, at the moment, what we've been looking at is the virus levels and tracking how those virus levels have increased and then dropped as the volunteers have recovered over about 12 days. So it's taken 12 days from when we've inoculated someone until their virus level has been cleared from their blood. And what we've seen, which was not unexpected, and it's what we know from dengue as well, is that what causes the symptoms in some ways is not just the virus. So when the virus is starting to replicate, people don't have any symptoms. So we can watch the virus level go up in the blood. We can grow the virus in the blood at quite high levels, and our volunteers were completely well. And then it's when the immune system recognizes there's an infection. That's when the symptoms start. So that's then when suddenly the rash appears and people feel like they have an infection. Whereas actually at that point, they're probably already starting to recover from the infection.
Interesting. So there's a delay in a way in the way the symptoms show up in that sense. So this study focuses on one particular serotype. It says the DEN3 serotype. Yes. Are there plans to extend it to the other types of dengue?
So we don't have any direct plans. What we want to be able to study, particularly, and why we have conducted this study in Singapore, where dengue is endemic, is so that we can develop a model of how dengue infection works in people actually who've had dengue before. Often the first dengue infection is mild, may not cause any symptoms, and it's the second infection where people are more at risk for getting a severe illness. And that's the bit that can't be studied in the US or Europe, where some other dengue challenge studies have been conducted. So in Singapore, we hope to be able to do a safe study of this so that we can develop an antiviral treatment and so that we can also understand more about how the immune system reacts to the virus, how it tries to fight it off, and how sometimes that immune response actually causes problems and makes people more sick.
And to the viewer who is listening now, how will this study then, or whatever findings that come out of it, how will it impact the way in Singapore, for example, or in the region we experience dengue or we treat it in some way?
Yeah. What I hope is that with these studies, we will be able to test an antivirus treatment. So there's a lot of different antiviral treatments which have been developed in the lab, but finding out which one actually works in patients and people who are infected is very difficult. So if I may offer something, so it's a bit like if we're sitting here trying to guess who's going to win the World Cup. It's very difficult. You can't really. And with a human challenge study, because we can both infect people and treat them at the same time, we can get a look into the future and we can actually find out which of those treatments are our best options. We may not know who's going to be the winner, but at least we'll know who's in the semi-final and the final, and we'll know that early.
Yeah, fascinating. Thank you so much, Professor, for coming in to share more about this. Well, Associate Professor Barnaby Young, Head of the Clinical Trial Unit at the National Centre for Infectious Diseases.